Understanding Addiction, presented by Alicia Albertson, Assistant Director at Blair Drug and Alcohol Partnerships. The definition of addiction is a primary and chronic brain disease. Chronic meaning progressive and fatal. Factors include genetic, psychosocial, and environmental. When reviewing the term genetic, many of us have heard the phrase predisposed to addiction, but really what genetic means is a person born with the potential for addiction, often influenced by environmental factors such as lifestyle or personal experiences, and that is contributed to by the psychosocial factors such as thoughts, feelings, and behaviors. It includes one or more of the following: impaired control over drug use, compulsive use, and continued use despite the harm, along with cravings. Many of us see our loved ones who struggle with substance use disorder and can clearly see the unmanageability and negative consequences that they are experiencing as a result of their addiction. However, we easily witness the continued use despite the harm that it is causing in their lives. Addiction is similar to other diseases in the following ways. Both disrupt the healthy functioning of the underlying organ. In cardiac disease, it is the heart. In pulmonary disease, it is the lungs. And in addiction, it is the brain. They produce harmful and, as previously stated, progressive effects that, if left untreated, will endure throughout the lifespan and can ultimately result in death. It is treatable, and recovery is possible once addiction is arrested. And addiction is also preventable. Many times when discussing this point, we see the debate disease versus choice. I always challenge individuals to think that if addiction was a choice, why would anyone choose to become an addict? When we look at how many people we know who have never even taken the smallest sip of alcohol, we cannot usually recall many. While there may be a few, even thinking on First Communion or a sip of champagne at a toast of a loved one whose wedding we attend, there are not many people who have not been introduced to alcohol in some way, shape, or form. Although it may not be problem use at that point, there is a reaction that can occur in the brain, and no one takes that first sip with the thought, I'll become an alcoholic one day. But why do some people become addicted to certain substances or alcohol while others do not? Our brains are all different in natural brain chemistry. How they transmit information into messages are neurotransmitters. For example, some people naturally have a more anxious personality. Some individuals may feel comfortable standing up in front of a crowd and giving a public speech or teaching a class, while others, their anxious personality would just not allow for them to do that. That is related to our brain chemistry and how our brains transmit information into messages. I'd like to share a video now. It will take me 1 second to pull it up. And this video is going to assist us in understanding a little more from a physician's perspective how addiction, in fact, impacts the brain.
Whitney Houston's death has us talking about her fight with addiction for so many years. And we don't know if it played a role in her death, but we do know that for more than 23 million Americans fighting addiction, quitting, it's just not a matter of willpower. New research actually reveals that substance abuse causes lasting changes in brain function. We're going in depth this morning with our host of Sanjay Gupta, MD. Sanjay Gupta, our resident doctor, the list goes on. You do everything basically. All right, let's talk about your piece. And I guess, why did you choose, this is your expertise, the function of the brain.
What exactly the brain looks like in someone who has addiction, who's going through this, is a pretty remarkable thing. I think it gives us a lot of insight into how it should best be treated and to also understand it. That's what I'm trying to do here. And I want to explain a couple of things quickly. First of all, this idea that someone has some sort of anticipation of taking a substance, that's sort of the first step. But then there are two important steps after that in the brain. And stick with me here. So imagine, for example, as you take a look at this animation I'm about to show you, that someone takes a drug of some sort. What happens there, and this is the middle of the brain, is that there is a sense of euphoria. That's dopamine there, those small little particles. That makes you feel good.
Is it any kind of drug? I mean, we're talking everything from cocaine to Xanax.
Yeah,
anything.
Just about any kind of drug, and not even drugs necessarily. It can be other things too, certain food substances, sugar, for example. There can be a certain addiction quality. But I think what's important is the next step. So you have that euphoria, but in someone who's a true addict, take a look at this picture here. On the left side of the brain is, you see the bright areas? That's still feeling good. That's the euphoria. But on the right side is someone who has an addiction now, not as much of that bright spot, and that is relevant. Why? Because they need more and more of the substance to try and get that euphoria back. Think about that for a second. You take the substance, you feel good, but in an addict, that good feeling doesn't last. So what do? You take more than ever before. And that's sort of the basic, sort of simplistic, but basic form of addiction.
Are those changes permanent?
Well, they last a long time. And exactly how long is a little bit of a subject of controversy, but people say you can eventually get to the point where your brain does feel natural pleasure again, but that can take some time. What doesn't go away is this idea of the memory of the addiction. So let's say you're a cigarette smoker, quit for 10 years, pick up another cigarette and start smoking again, and right away you can go back into addiction. Whereas if you've never smoked before, it would take you some time to build up that addiction again.
It's like what they say, folks that we know that have gone through treatment say once an addict, always an addict. There's truth to that, right? It's you aren't just cured. It's a constant battle to stay away from the temptation or feel that euphoria, right?
That's right. People say that, but I wanted to show the pictures of the brain to really explain why that is. You see that dark areas of the brain, you need a lot of the substance to get that euphoria back. So that's why relapse occurs so quickly. They say 3 days of acute withdrawal, which is painful, 3 months where you're the most sort of subject to relapse again, and 3 years before you really start having natural sort of pleasure again from substances.
That video really gives us a strong inside look at what happens to the brain when substances are introduced. I'm going back to the slideshow now because I want to look a little bit deeper at the pleasure center of the brain and that idea that the physician talked about of natural pleasure. The power of the reward system in humans extends from the midbrain to the frontal lobe, where there's reasoning, judgment, and decision making. And it begins to change because of the substances used. They disguise themselves as natural chemicals. So, for example, the pleasure center of the brain, when we're hungry, we feel grumpy and we feel tired, maybe miserable. They say, you're not yourself, have a Snickers, as a joke, right? Because when we're feeling hungry, our brain is saying we need to eat. And why does it say that? Because we need to eat to survive. So our pleasure center rewards us with that dopamine for those natural things that we need to do to continue to live. So when we eat food, our brain releases dopamine because it's rewarding us for doing something we need for our bodies to survive. But those chemicals that we use with substances masquerade themselves as that natural occurrence. However, as you see here in the picture, a significantly more amount of dopamine is released. So that same part of your brain that tells you and rewards you because you need to eat to live also gives your body the same message in significantly higher doses that you need to use to survive. Because of the way the brain interprets those chemicals, those drugs ingested as natural chemicals occurring in the brain, an individual who is struggling with substance use disorder is literally told, you need to use to survive. And that is why we see individuals who choose drugs over food, water, shelter, those basic human needs that are ingrained in us to survive. Drugs become more important and alcohol become more important of those things because the brain recognizes them as more important than even basic things like food to live. This slide gives an example of some of the neurotransmitters that are affected in the brain, as well as how it is distributed throughout the central nervous system of the body, what functions are affected as a result of this use, and what drugs actually affect those functions. This can be very beneficial when seeing an individual or knowing a loved one that we may be concerned that is struggling with substance use disorder or alcohol use disorder, because it gives an idea of how the body is indeed affected by the substance and how the brain chemistry is altered as a result. If our brain chemistry is not balanced, thoughts will be altered and actions will be maladaptive. While that sounds complicated, it really is broken down that brain chemistry affects our thoughts and thoughts then affect behaviors. If a person is struggling in those early phases of recovery, even up to 3 to 5 years, as the physician indicated with natural pleasure, thoughts will be distorted because brain chemistry is altered. So that shame and that guilt that goes along with substance use disorder can impact thoughts. Maybe negative thoughts of, I have never been able to do this before, why will I be able to do it now? I'm a failure to my family, I'm a disappointment. And those thoughts and those behaviors can lead, those thoughts can lead to negative behaviors, negative actions, because there maybe isn't a thought that they can be successful. Because of the impact on the brain chemistry, like serotonin levels, when an individual's serotonin levels are too low, they can actually lose the will to survive. That's when we begin to see things like suicidal ideation. We see suicide attempts, and there is a large linkage between substance use disorder and losing the will to live. So how is this imbalance corrected? With addiction, abstinence initially, then we can learn to treat the symptoms that have come as a result. There are anti-craving medications like Vivitrol for adults that assist in blocking cravings for substances such as opiates or alcohol, two of the largest consumed substances in Blair County, as shown through our data here at Blair Drug and Alcohol. There are also other medicated-assisted treatments that can assist with opiate use disorder. But once we have begun to treat addiction, we then start to look at the symptoms like lack of motivation, obsessive behaviors, depression and anxiety, negative attitudes, poor sleeping and eating patterns, low self-esteem as discussed before. Those can all be a result of addiction and the lifestyle that goes along with it. It also can be warning signs of someone who may be clean and sober for a while, that they have slipped back into old behaviors or routines. After we begin to treat the symptoms, we can also assess for an underlying condition related to mental health, depression, anxiety, even a more severe disorder such as schizophrenia, bipolar disorder, and there are different medications that could potentially treat these mental health underlying conditions, and usually they are used as non-addictive medications to be able to support the recovery in the mental health arena as well. There is a large linkage between mental health and addiction. Many people have co-occurring disorders. But what comes first? Does the addiction cause the chemical imbalance, or does the chemical imbalance cause the addiction? Is it predisposed or induced? And what we hear a lot in this field is nature versus nurture. But really what I like to say is nature and nurture. As research shows, individuals' health results from dynamic interactions that happen between genes and the environment. For example, and this is a great example, high blood pressure. It's influenced by both genetics and lifestyle. If my great-grandmother has high blood pressure, and my grandmother has high blood pressure, and my mother has high blood pressure, I myself am going to be likely to have high blood pressure. And if my lifestyle includes a healthy diet, low stress, lots of exercise, I may decrease my likelihood to have high blood pressure, but it does not mean that I won't. However, if my lifestyle or environment has a poor diet, high stress, low exercise, I'm going to increase my likelihood of having high blood pressure. So then I'll have a lifestyle as well as genetics that set me up to have high blood pressure. So it is definitely a balance between genetics as well as lifestyle, but no matter how positive my lifestyle is, it does not mean that I will not have high blood pressure, just like addiction or substance use disorder. Because often we correlate substance use disorder to negative lifestyles, poor attitude, or moral deficiency, but the reality is addiction does not come from being a, quote, bad person. It is just a bad disease. Research suggests that genes can also influence something as simple as how a person responds to his or her environment, placing some people at higher risk than others to struggle with addiction. Some of those risk factors, again, biologically or genetically, as well as environmentally, play a large role. Something as simple as gender. Women are more likely to be addicted to prescription medication, research shows, versus men who are more likely to be addicted to illicit substances. Why is this? Environmental factors could play a role. Someone who is pregnant, a woman is pregnant, gets prescribed pain medication as a result of their labor and delivery, can influence then gender-wise why a woman might be more likely to become addicted to prescription medication. Obviously, in the community, early onset of use, availability, cost, those all play a role into how quickly the brain mechanisms are changed, resulting in addiction. For example, environment. I don't like to use the term good kids and, quote, bad kids because I don't believe in either. However, when we look at the stereotypical good kid, even they are exposed to alcohol. Typically, the golden age is around 12. It's what we see here at Blair Drug and Alcohol when we begin doing assessments, and when we do assessments on adults, we see that the early onset of use is usually around the age of 12. And that does not mean problem use, but they were introduced to a substance. So let's say we have a group of kids who attend the party after the football game, and they are all exposed to alcohol. And then there's a smaller group that may be smoking marijuana, and a smaller group that may be doing cocaine, and then a smaller group than that may be using opiates, and a smaller group than that may be using methamphetamines. But the reality is, everyone at the party becomes exposed. And that exposure can lead to experimentation, and that experimentation can lead to problem use and full-blown substance use disorder quicker than anyone could really imagine. And it's because of that idea in the brain of memory and storing addiction and storing the idea of use as first it becomes use equals fun, and then it becomes use makes me feel good, and then it becomes we need to use to survive. And that's how quickly the patterns in the brain can change. So now what? Once someone is struggling with substance use disorder, they'll go through different what we call stages of change before and during the recovery process. Pre-contemplative, contemplative, preparation, action, and maintenance. The pre-contemplative phase is when an individual does not even recognize the problem yet. Usually we hear, I don't have a problem, I'm not sure why I'm here, I don't struggle with that, there's no issue. Contemplative is a person may recognize that there's an issue but are unsure or unready to do anything about it. Yes, I use, but I can stop whenever I want to. I just don't want to right now. Preparation is when they begin to prepare to take action. So maybe they are now openly talking to you or someone at school or a friend about, yes, I'm struggling with alcohol, I'm struggling with other substances, I'm not sure what to do, but I know I need to do something about it. They're looking for guidance or direction. Action is when they begin to take those steps towards change. They're willing and start attending treatment. Maybe it's an inpatient program or an outpatient program. They are starting to take the steps to find recovery. And the maintenance phase is once a person has entered into recovery, they're doing the things they need to maintain that. Maybe routine attendance at support groups. They've changed people, places, and things. They've made permanent lifestyle changes that will support their recovery process. But the reality is these phases can be interchangeable because of different situations that arise. You may find someone in preparation fall back to contemplative and maybe later move into action. So it's all a matter of where a person is at in their process. So does it matter what stage of change someone is in to intervene? No. It's much easier to help someone that's in the action stage or later, but it's never too early to talk to someone. What I say is what it will make a difference is how they respond. If someone is in pre-contemplative and you bring to their attention that they are struggling with substances, they might not respond well to that. I don't have a problem. I don't know what you're talking about. However, interventions can help raise awareness and address the level of denial over someone's consequences. It's like planting a seed. You plant a seed in that person, and really it's on them whether or not to water it. Just remember that everyone's bottom is different, and it can always go deeper. But when you're confronting an individual, you're confronting the disease, not the person. Because again, a person who struggles with substance use disorder is not a bad person, it is a bad disease. What can be done? The initial step would be have a drug and alcohol assessment completed. We can do that here at Blair Drug and Alcohol Partnerships. There is no charge for this service and it is completely confidential. After the assessment is completed, the case manager will refer the individual to treatment, whatever criteria it is that they meet. It does not mean that individual has to go to treatment, but we do provide all options available to help engage them into the care they may need to find recovery. We also provide case management and peer recovery specialists to support a person obtaining needs they might have in the community, linking them to resources like housing, childcare, transportation, food, different items that will help them sustain their long-term recovery. Obviously, there are obstacles or barriers when helping someone or trying to get someone to find recovery or seek what they need to become stable. Enabling is one of those actions. It's usually by someone in the addict's life that continues to keep them comfortable or what we call co-sign or make their behavior okay. For example, my son doesn't have a problem, he's and there's that term again, good kid. And we have to remember that it is not about being a good or bad person, it is a disease. And that goes along with stigma. Substance use is typically seen as a weakness. People may be afraid to ask for help because they don't want to be looked at as a person who struggles. But really all that does is create more of a need for services as addiction continues to grow. We need to make a safe environment and create a safe environment where people feel comfortable asking for help. One way we do that is through education like this, helping to share what addiction is and understanding that it is a disease and that it can be treated. And when addiction is arrested, recovery is possible. And people who are struggling are not alone. And also families who are struggling are not alone. There is a HOPE support group that meets here at Blair County Drug and Alcohol from 5:30 to 7:30 now, every Wednesday night. This group is for family members or loved ones who have someone in their life struggling with addiction. We provide support to each other and talk and support each other through the difficulties that we face as family members. There's also Healing Hearts. It meets every second and fourth Thursday for individuals who have lost a person as a result of this disease here at Blair County Drug and Alcohol from 6 to 8. There are many additional support groups for individuals who struggle with addiction from all lifestyles and backgrounds, and they can also be found here on our website, dates and times available, along with other options that people may utilize to help find recovery. If you have any additional questions, please contact us here at Blair Drug and Alcohol through our website on the Contact Us tab, or call 814-381-0921, and we would be happy to support any individuals with their needs. Thank you.